Maximize nerve supply. The number one thing that we talk about, and the most important thing, is making sure that your nervous system is working properly, making sure that your brain can communicate with your body at 100%. Number 3, maximize nutrients, putting the right foods in your body at the right times during the day so you can get the best benefits. The one we're going to talk about tonight is maximizing oxygen use through exercise and building lean muscle. This is a very important one. It's essential to life. Movement is essential to the brain, and you'll find that out later. And maximizing your mind, just de-stressing your life, making sure that everyone you associate yourself with is positive. And so the importance of exercise. When I talk about exercise, I don't want to put like a guilt trip on you. I don't want to make you feel guilty for not exercising, for taking care of yourself. What I want to do is I want to make sure that you understand the current situation of our society and where we're headed by the things that we aren't doing. 13.5 million people have coronary heart disease. 1.5 million people suffer a heart attack in a given year. 8 million people have adult onset diabetes. 95,000 people are newly diagnosed with colon cancer each year. 250,000 people suffer from hip fractures. 60 million people, a third of the population. So a third of the population now is considered overweight. And then at the bottom, 50 million people have high blood pressure. You know, if we live in the country, that's just the facts. You know, that's happening. It's not happening in Japan. It's not happening in France, where their intake of fat is so high. That's their main source of nutrition is a high-fat diet. So the principal benefits of exercise. We'll just go into this before we actually talk about exercising. It reduces your risk of dying from heart disease. So 5 out of 6 people, including in this room, are going to either die of cancer or heart disease if we keep going at the pace we are right now. It boosts your immune system. Cancer is it's a result of poor immunity. If you don't take care of your immune system, cancer and heart disease. Increases HDL, the good cholesterol. We're not really worried about total cholesterol because everyone needs cholesterol for their brains and nervous system. We're worried about the good cholesterol because these are the good guys. These are the ones that clean out your arteries and keep them functioning the proper way. Increased bone health. The National Osteoporosis Society says that weight-bearing activity builds bone density along with vitamin D that you get naturally from the sunshine and in fish oil, and combined with calcium, not from milk or dairy products, but from green leafy vegetables. All these 3 combined are a perfect environment for bone growth. So, by exercising, getting some sun, eating your salad, then and only then can you actually start building bone. You know, it's not the calcium that actually builds the bone, because you can have as much calcium in your body as you want to, but if you aren't doing something to constantly stimulate your body to deposit that calcium in your bones, then it's not going to work. You're just going to excrete it. And actually now this has been a big push for osteoporotic medication. You know, a lot of people are on these because they think it's going to help with their levels of calcium or help them not get osteoporotic, but actually it's causing severe side effects. It's actually causing, the major one is osteonecrosis of the jaw. I don't know what you guys know what that is, but it's actually your jaw rots from taking these drugs. And you know, it's so serious that dentists and oral surgeons are actually telling people to stop taking these drugs 2 years before they have any dental work, because when they get in there, they actually see that this is causing their jaws to rot away. Lowers your chance of high blood pressure, colon cancer, and diabetes. Helps maintain healthy bones after you've actually built them. And this is a big one. Assists in overcoming depression. This is huge in our society. It's the #1 selling drug on the market right now. You know, teen suicide right now is the leading cause of death, and most of these kids are on antidepressants. You know, however, just moving your body, exercising boosts these good, feel-good hormones like serotonin, and that's actually what they're trying to do with these drugs, boost serotonin levels. And Duke University just put out a study saying that people who are depressed 4 months or longer, all of them who exercise, 60% of those overcame their depression without taking antidepressants. So just imagine, I mean, if a drug was 60% effective, I mean, someone would win an award for that. Obesity is reduced, and back pain is reduced. The exercise we're going to show you tonight, or today, you know, they're functional exercise. They're going to help your core muscles that protect and stabilize your spine. And they're not just effective for when you're working out, they're effective in everyday activities. Helps control blood sugar and increases productivity. CDC on their website says that exercise decreases the number of sick days by 30% over non-exercisers. So movement is life. Without movement, you cannot sustain life. Think about it. Blood cells move to carry oxygen. Everything in your body moves. Breathing carries oxygen. Heart beats to pump blood out to your body, and your spine should be constantly moving. The motion of the body was created to supply joint nutrition for activities of daily living, picking up socks, doing the laundry, doing the dishes. You know, that's what it was created for. Motion creates the proper joint-brain function. So that means every time a joint moves, it sends a message to your brain, then it sends a message back to your body and tells your body how to function and what to do with that message. So that's when, you know, it kind of acts like a generator. So our body moves, stimulates our brain, and it works our body. And that's why in paraplegics, they've done studies on paraplegics and people who have lost half their ability to use their limbs. EMG studies have actually showed that, you know, over time their brain actually deteriorates and stops functioning because they're unable to move their body. And you'll see why moving your body and the brain is so important later. But proper spine motion is essential for brain function, coordination, concentration, learning, motor control, organ function, and immune response. And not a lot of people know that. They just think the brain controls everything and exercise is just good because it's good. Robert Sperry, I don't even know if you guys knew this, but in 1982, he won the Nobel Prize for studies on the brain and structural influences from the body. So the brain spends 90% of its time relating the physical body to gravity and only 10% on actual function. You know, that's huge when it comes to movement because that means that 90% of the stimulation and nutrition sent to the brain comes from body movement. So when we move our body, it nourishes our brain, it gives it what it needs, and then the brain can do with whatever that nourishment the body needs too. He also showed that the more structurally distorted you are, so high shoulder, high hip, forward head carriage, the less energy you have for functioning, like metabolism, healing, thinking. And that's because now the brain has to worry about relating your distorted body to gravity. It decreases that functional level, so you actually lose function in your brain, and that causes organs to shut down. So just by moving, you boost metabolism, heal better, think better, and function better. And now you can see why exercising for a facade is just minuscule and it doesn't really mean anything on the grand scheme of things. So from brain to body, the messages from your brain have been created for proper movement. So the basic building blocks of nutrition are protein, carbs, fats, and water. But actually movement has been called the essential nutrient. So if your body doesn't move, the brain can't be nourished. And if the brain isn't nourished, it can't use those protein, carbs, and fats and water to help your body function either. So movement of children, this is a big thing because, you know, as you know, rates of autism, ADHD, mood disorders, they're skyrocketing. And it's also due to toxicity, but it's also due to movement. You know, movement plays a big role in a child's development, especially at that stage, because they learn how to crawl, then they learn how to walk, then they learn how to run. And it just goes in a progression because they constantly need to be stimulated with that mechanical input. You know, today kids are getting visual input and audio input, but that's from video games and television. And now schools are even discontinuing their physical education program for children, so the only exercise that children may have gotten is now being taken away from them. So you can see how detrimental that is and plays a big role in where it's heading. Pediatrics.org, I just searched on pediatrics.org about physical fitness and sickness. And over 5,000 studies came up on the effects of decreased mechanical stimulation and how it causes developmental impairments, concentration problems, learning disabilities, behavioral problems, and increased illness. You know, when children come into the office, we constantly see a combination of all these, whether they have an ear infection and autism, or whether they have mood disorders and colic or whatever. And when they took them to the medical doctor, what do you think they told them to do?